A caregiver is somebody that takes care of somebody who can't take care of themselves.
That role has fallen to me just naturally, to be the caregiver, and I'm blessed by that. It's hard, and sometimes you get frustrated, but I wouldn't trade it for anything. It's been a blessing to me.
A caregiver is someone, I think, that just has a heart. Just absolutely has a heart.
You have to be strong because you cannot let that disease get you, because you know who is going to take care of them.
A caregiver is someone who loves someone else and does whatever is necessary to keep that person comfortable.
We felt it was really very important for Daddy to stay at home. That's why I gave up my whole life, moved out there, moved in with him, because that's what he wanted.
It's one of the most important things in the world, that to give comfort and care to some person in his declining years.
The emotional aspects of caregiving can be extremely complex and uniquely personal to each individual. But in talking to caregivers, we have found they have many concerns in common. In fact, coping is the one topic that seems to be the most difficult for caregivers. Finding a sense of balance in your own life and family while maintaining a sense of identity throughout your role as a caregiver is a constant challenge for most people. Emotions tend to run the gamut during the caregiving process, from a sense of fulfillment and encouragement to feelings of frustration, guilt, and even depression. In this section, we'll first examine the emotional and psychological issues that caregivers commonly face, both positive and negative, then address how to avoid many of the pitfalls that caregivers often experience. If you're new to caregiving, you may be feeling overwhelmed, wondering how you'll possibly manage the physical and emotional tasks of caring for your loved one on a daily basis. If you're a more experienced caregiver, you may periodically wonder if what you're feeling is normal and what you might anticipate from this point forward. Whatever your situation, those who have been caregivers will tell you the responsibility of caregiving is one of the most challenging experiences you will ever face. On the positive side, caregiving can be an extremely enriching experience. It can provide you with the opportunity to give back to someone who has given so much to you. The caregiving relationship can also give you a chance to get to know a loved one in a special, unexpected way. Similarly, caring for a loved one opens the door to your own personal growth and self-discovery. You may be surprised to uncover hidden talents you never knew you had. You may also uncover new facets to your personality and discover an inner strength and spiritual awareness. Amid the daily rigors and routines of caregiving, you may also find a new appreciation for simple pleasures and the precious moments in life, or gain greater insight in the importance of family and friends. On the other hand, caregiving presents challenges for many people which can feel overpowering and overwhelming. Caregiving is challenging for a number of reasons. One, you're suddenly confronted with a number of new roles all at once, many of which may feel uncomfortable and foreign to your areas of expertise. Additionally, you may find yourself reversing roles with the person you're giving care to, such as becoming a parent to your own parent, or needing to take charge for a spouse who has always been extremely independent.
Most of the caregivers that I meet, they're in two categories. They are frequently an elderly spouse taking care of an elderly patient, and they're not feeling well. They have their own health problems that they're struggling with, and those are the ones that are so at risk for something happening to them and leaving that patient without a caregiver. The other group of caregivers that I normally see is an adult child who has children at home and who has the adult parent, and they're just like the filling in a sandwich, just being spread, being pulled by everyone. And their stresses are different. They normally are in good health, but they have too many roles, more roles: wife, mother, caregiver, plus all the other roles. They just have more on their plate than they can say grace over.
There are many situations that caregivers find themselves in, and each can be unique in its own way. Even healthcare professionals who become caregivers for loved ones frequently find themselves facing issues and experiencing emotions outside their comfort zone.
Well, I'm a nurse, and I thought being a nurse would help me out, and it does, particularly with things like giving bed baths and helping out with incontinence and nutrition and things like that. But I think as a nurse, I also feel like I should be able to do a better job of what I'm doing. And I don't mean the physical kind of things, but I mean dealing with the emotional part of the role change and the emotional part of seeing my mother declining slowly, but certainly declining every day. And I think that's made it probably harder on me as a nurse, and I would like to and need some help with that kind of problems. And I think other people who take care of people in their homes need that kind of help too.
Frequently, the changing demands of caregiving are intensified by the demands on the caregiver to be knowledgeable in so many diverse areas.
You have to be a companion, you have to be a janitor to clean up the place, you have to be a decision maker, because usually the person you're giving care to certainly cannot make the decisions. You have to be really good at working the system when you're talking about Medicare or Medicaid or some of the agencies out there as well, because while there are people to help you with that, it really is a maze, and you kind of have to find yourself your own help in the community through those kinds of agencies.
Feeling somewhat ill-prepared or inadequate are normal reactions for caregivers, but there are some basic rules that can help diminish the unknowns of caregiving in the early stages. In the beginning, try to anticipate as best you can what to expect once you bring your loved one home.
First, let's talk about the physical things. Do you need to have a hospital bed? Is that something that's necessary? Will I need home health? Will I need to have certain medications on hand all the time? Are there certain medicines that I only need sometimes? These are all things that need to be addressed prior to someone leaving a hospital setting. And most of the time, a social worker can help you adjust and to get things in order for you.
Families need to sit down together as a unit and discuss all the ramifications of moving a relative in with them. You know, from the youngest child to siblings that may not even be living in the community, but should have some part in the discussion of what might be happening to their relative too.
Caregivers need to be very honest with themselves, and sometimes it might be helpful just to sit down and make a list of, these are the things that I feel comfortable with, that I feel like I'm handling okay, and these are the areas where I'm feeling overwhelmed, or I feel like I don't have enough information, or I don't have enough support. And being able to identify those areas where they need more support is a very big step towards getting help and being a better caregiver.
Another helpful tip: try to educate yourself as much as possible about the prognosis of the person you're caring for. As a caregiver, you should know about the disease process and what to expect if there is progress or regress. This knowledge will help you emotionally prepare for the future.
The challenge is finding a physician who is a good communicator and who will spend enough time with you, giving you the information you need to be a better caregiver. I think it's very important for caregivers to discuss the patient's condition with a physician. And one of the things that we have found that is helpful for doctors is for the caregiver to make notes before they take their loved one into the doctor's office, and hand it to the receptionist when they first walk in the office. and say, please have the doctor read this before he comes in for the exam, he or she comes in. That provides information to the doctor that he or she may not pick up on during the regular examination. And the caregiver is the best source of information about how the patient is doing.
It's important to be aware that the homebound patient has unique medical needs. If at any time you're not satisfied with the services you're receiving, you should make this known and seek out qualified individuals who can help you find the level and type of care your loved one requires. Often, it's necessary to find physicians and counselors that specialize in geriatric or long-term care. Caregivers face personal challenges beyond providing care to their loved one. You may experience difficulty adjusting your schedule to the demands and needs of your patient. For many people, juggling daily activities, working outside the home, and allowing time for family and other responsibilities present added pressures.
Your schedule becomes that person's schedule. Your daily structure completely changes. There's no definition between night and day necessarily, because the person you're caring for no longer has the same sense of time and the same sense of reality. My father would often like lasagna for breakfast. That's what he wanted, that's what we gave him. The only thing that kind of kept you grounded as to what time of day it was TV.
The days are long. That's what I hear probably more than anything for caregivers, is the days are long.
To help you gain greater control over the demands of daily activities, try to establish regular routines. Adhering to the same schedule as much as possible helps both you and the patient know what to expect each day. It instills a sense of security for the patient and provides structure to his or her life. Another way to help you maintain control is to stay organized. Be sure the things you need on a consistent basis are readily at hand. If you need additional storage space, get extra shelving units or filing cabinets, then make it a habit to put items in their proper place and encourage family members to do likewise. To keep the household organized and running smoothly, ask family members to help with specific tasks such as cleaning or cooking. Then agree on specified chores and time expectations. Feeling confused and pulled in several different directions is a common complaint from caregivers. Demands from work and family, plus those created from the caregiving process, may make you feel like you're not able to satisfy everyone or anyone.
I took care of 3 different loved ones, and my mother-in-law, my father, and my mother. And for me, taking care of my mother was the most difficult, just strictly from the fact that she was my mother, and it was just very hard. I wanted to please her, and I wanted her to be happy, and I wanted her to feel well, and when I couldn't make her happy, it was just very difficult for me.
In our society, we're often taught to view feelings of insecurity or inadequacy as negative or abnormal. Yet, listening to other caregivers, you'll realize these emotions are normal and common. Caregiving can take an emotional toll on people in many ways. One of your prevailing feelings as a caregiver may be that of dread, anticipation, or fear. We all fear the unknown, and caregiving plunges us into a chronic state of wondering what tomorrow will bring. You may fear the responsibility of caring for someone with medical and nursing needs. Caregiving can also kindle your own fears of illness, death, dependency, and abandonment. At other times, you may feel anger and resentment toward the person requiring care.
It's you have your days that you are angry and you don't know to whom because it's not his fault and it's nobody's fault. But you're angry because you say, why? And some days that he's more confused than others, and you lose your patience because you need a lot of patience with this disease. And you cannot complain, you cannot tell him nothing because he don't comprehend.
One of the hardest things for me was feeling guilty, feeling like I was a bad daughter because I felt resentful.
These feelings of anger and resentment can ultimately lead to a sense of guilt. Guilt about being angry at the patient for keeping you at home and placing this burden on you, the caregiver. You may also feel guilty about denying the severity of the patient's condition.
Don't feel bad if you do feel guilty. I think that was a problem that I had, was just so much guilt because I thought I shouldn't be feeling this way. I should be happy to take care of this person. This person spent their whole life taking care of me, but it's not easy. It's hard. It is not easy when it's all consuming. And so if you have those bad feelings, don't beat yourself up too badly for having that.
Guilt can take on many forms. For some, it's guilt that you may have played a role, no matter how obscure, in your loved one's condition.
People who have had a relationship with a mother or a father and are now caregivers, a lot of times feel guilty about having them at home or having them in a nursing home. I think there comes a point for all of us where we have to take responsibility for ourselves, and a lot of the guilt that comes on is that we feel that we should have taken the responsibility for this other individual and that wouldn't have happened. Someone who falls and breaks a hip and you come and find them on the floor, one of the first things that the daughter or the son will say, if I were here, this wouldn't have happened. Well, even if you were there, it could have happened. So the guilt feelings of something has occurred and I could have prevented it, and it's a control issue. And most caregivers want to be able to feel that they can be in control of things. And there are many things that are out of our control, and we won't be able to have it. And in our multicultural society, there's no way that someone can be able to pinpoint for one person, this is what you should have done in this situation.
Because many diseases are progressive, caregivers often feel badly that their patient doesn't get well or isn't getting better. And the disability over time causes the patient to worsen, the condition to worsen, and the caregivers often feel like they haven't done enough. Or many times they will feel guilty about doing things for themselves while their patient is suffering. So the relationships or activities that they do keep up, they feel badly about.
Don't be surprised if you feel guilty about not doing enough or even about doing too much.
People really set themselves up for physical health problems, mental health problems, when they try to do it all themselves. And it's a very dangerous position to be in because ultimately you're putting your loved one at a greater risk. This is not an area where one wants to strive to be a martyr.
I've had to learn right through the hard way that you cannot do it by yourself. You have to accept what help is out there, find the help. Don't feel guilty about letting someone else help. That was a major thing for me because of my personality. I would feel like that if I couldn't do everything, then there must be something wrong with me. I had a lot of guilt, and in fact, I even went through some depression. Did not know that's what it was because I was just going through the motions, I was functioning, but there would be mornings that I just thought, I just don't think I can get up today. But I finally realized that I needed some help, that what I was feeling was okay. I had some therapy. I talked with a lady, a psychologist that specializes in geriatrics and elder care, and she helped me an awful lot. Don't be afraid to get that kind of help. If it just gets overwhelming where you can't swallow and you can't breathe and your heart feels like it's pounding, then talk to somebody and get some help. Don't try to do it all on your own.
You may feel guilty if you can't alleviate your loved one's suffering. You may feel guilty when you're too tired to do more, or if you enjoy a stolen moment. You may experience a form of survivor's guilt because you are well and can enjoy life. And even more upsetting, you may feel terribly guilty if you sometimes wish the person would die in order to end the ordeal. It's important to realize that all of these feelings are normal and common among caregivers. It's especially important not to let yourself get consumed by these feelings. If you do, these emotions can take a significant toll on your general state of mind. In many cases, this can lead to forms of depression that may appear totally out of the blue.
Something that's very important that caregivers need to address is depression in themselves. They may not understand it. You may not understand that you are having a depression, or anxiety for that matter, until you sit down one night and you sit there and you say, why am I feeling the way I am? Depression is an illness just like someone having a strep throat. And it's something that can be treated along with other therapies to work with it.
You know it's time to seek help for depression when there have been at least 2 weeks that you have felt overwhelmed, that you have felt irritable, that you have experienced crying spells, that you have noticed that your appetite has changed. Either you're eating a lot more or you have no appetite at all, that your sleep habits have changed. For some people, it's that they don't want to get out of bed in the morning. For other people, it's that all they want to do is sleep, or they can't sleep at all. When you notice these changes going on in your body, it's usually a sign that something is not right and it's important to seek help.
If you can't find therapy, if you can't find a professional to talk to, read everything that you can get your hands on caregivers. There are a lot of us out there now, and it's the feeling when the more you read and the more you talk to people, everyone has those feelings, and so somehow it helps to know that you're not the only one, and you're not the bad daughter, and you shouldn't be feeling guilty, and that you're doing the best that you can do.
Suppressing your feelings requires energy, and you need that energy for caregiving and for leading as normal a life as possible. It's important to acknowledge what you're feeling and accept that you feel the way you do. Remember, you can't help how you feel, but you can control how you act on that feeling. Make a conscious effort not to let yourself get submerged in depression or grief. If you are feeling down or depressed, admit it, accept it. Then call a friend or do something fun, something you want to do, to lift your mood or get a fresh perspective.
When you find yourself getting to the burnout stage, to the stage where you think you cannot go anymore, that's the time that you need to take a break.
Back away from the situation as much as you can. Go out for a walk. Try to steal away a couple of hours and read. Go and get your hair cut. Try to have lunch with a friend. Just try, when you are away from the situation, just try not to think about it, and then, because it'll be waiting for you when you get back, and then when you get back, then you can start all over again.
Most healthcare experts agree that routinely taking a break through exercise or a change of scenery and developing supportive relationships are the best antidotes to depression. Caregivers often find the most meaningful relationships they develop during this process are with other caregivers. The people who most know what to do are people who have been in that same situation. Having these shared experiences and emotions allows caregivers to open up with one another in a very meaningful way. Support groups provide an open door for the caregiver to develop these relationships.
I think the main thing that caregivers should know about a support group is that it is a great place to come to realize you're not alone. And that's very important because it's easy to feel isolated when you are caring for someone and it takes up so much of your time. I think the other piece would be that a support group is really there for encouragement and information and support, of course. When you come to a support group, it's important to realize that no issue is trivial, that everything that may be concerning you is probably concerning someone else. And it's important that you not feel afraid to mention the things that you need to learn more about, the things that frustrate you, as well as maybe some of the positives that you find through your caregiving experience.
With a support group, you'll have people there that can tell you what they've gone through, what you've got to look forward to, and be prepared.
In groups, one thing that makes people feel more comfortable about being open is that the group meeting is confidential. And one of the things we always tell our group members is to respect the privacy of the other people in the group, so that when you bring something up and you share things that are very often personal, that it is important for that information to remain in the group and inside the room where we meet and not go outside to other people. That's part of what allows trust to build among group members.
Whether or not you decide to participate in a support group is a personal decision, but most people agree it can be amazingly helpful. To find a support group within your community, contact your local United Way or health department, or ask your physician or clergy for recommendations. People who take care of others do run the risk of draining their own energy reserves, both physically and emotionally. Experts refer to this malady by several names. The most common is compassion fatigue.
There may be subtle changes. You can have, for example, someone decides, I'm not eating as much. They lose sleep, or they sleep all the time. They'd rather sit in a dark room and stare at a window than to be active into looking at other areas of activity with it. There may also be just a combination of all three of those things. You may see a behavior change. You may see someone who decides to get very angry at times and can blow up at the drop of a pin. So those are things a caregiver needs to address and to look at.
The warning signs of compassion fatigue are similar to those of depression. Common symptoms you should be aware of include difficulty in making even simple decisions, emotional numbness or apathy, racing thoughts, memory or concentration problems, tearfulness or frequent crying, feeling unable to perform routine tasks due to a lack of energy, losing interest in having friends or hobbies, sleep disturbances such as difficulty falling or staying asleep, or feeling tired even after a long night of sleep could be a sign of fatigue, or changes in appetite, either eating too much or too little. Other signs include persistent headaches, physical exhaustion, or frequent medical illnesses or infections. An apparent transformation in moods and behaviors with negative consequences, such as substance abuse or impulse spending. Prolonged irritability with simmering anger, resentment, or rage. Escalating guilt and feeling out of control are all common symptoms, as are thoughts of running away, permanently hiding, or even committing suicide. If you experience one or more of these symptoms for more than 2 weeks in a row, it's important to seek professional help.
The first signs I was really becoming emotionally exhausted was that I couldn't do the things that I love to do, and I had all this time to do it. I had all this free time to write, read, create, and I couldn't do it. I didn't feel like doing anything. I was just a vegetable. I knew I was getting to the point where I just couldn't do it anymore. The simplest tasks just became totally overwhelming.
you just don't want to get up in the morning. You just can't face another day. If you feel like sometimes I couldn't breathe, I was hyperventilating. Situations, my heart was pounding away. You get angry at small things that normally would not have affected you at all.
I have before, sometimes nights I only sleep 2 hours. And it's hard when the next morning you have to take care of 2 sick people and cook and clean and do laundries.
When you go to bed, you're up again in an hour and a half, and then you just kind of lay there and your mind is spinning and you're so tired, your body's tired, but your mind is spinning, and then maybe get off to sleep a couple of hours and wake up again.
Left unaddressed, these emotional danger signs can develop into serious problems, resulting in clinical depression, suicide, substance abuse, addiction, abusive behavior, or acute illness.
It has not been unusual for me to become involved because the caregiver has died from a heart attack or has just become so stressed out that they have been hospitalized. And my job is to go in and make plans with that patient for their care because there's no longer a caregiver. And it's really not uncommon in, our field to see caregivers literally work themselves to death, neglect their own medical problems because they can't take a break to go to the doctor or to the hospital for appropriate medical care. And they, neglect themselves in the process.
Although caregiving is a constant commitment, there are times when caregivers face the greatest risk for compassion fatigue. It's important to be aware of those times when you'll be more vulnerable to emotional and physical exhaustion. For example, the early stages of caregiving, before you've had a chance to adjust to your new routine and get your support system in place, or a change in the patient's mental or physical health, which could increase your caregiving responsibilities and trigger guilt. Even an improvement in the patient's condition can disrupt your set routines and emotional stability. A decline in your own energy level or health may be especially frightening if you don't have a support system in place and someone available to take over for you. Stressful situations or unforeseen events, such as the loss of a family member or friend, can trigger a crisis when you're already stretched to your emotional limits. You may find that even happy events like a wedding or holiday exhaust you. Other factors will also affect how well you adjust to various caregiving situations. These include your basic personality type, your past experiences, your connections to the community and support resources, your current responsibilities, as well as your basic physical and mental health.
The normal situation is ebb and flow. You have the feeling and then you don't have the feeling. We all have the experience in situations where even in acute grief, like around a death, if you spend any time at all, like in visitations in funeral homes, you'll experience families going into the depth of feelings of loss and grief, and then in 5 minutes they're laughing. About something that happened in this person's life, and they're enjoying it all of a sudden. There's an ebb and there's flow. And when that is occurring, when there's this ebb and flow moving back and forth, one can go into some depth, depth of despair even, and yet come back. It's when one gets into that depth of despair and then for whatever reasons cannot bring themselves out, that's where there's not the balance.
Some people are energized by caregiving, but may have difficulty rebuilding their lives or adjusting to the fact that their day-in, day-out responsibilities have ended or transitioned in some way. A prime example of this frequently occurs after a loved one has been moved into an assisted living facility or skilled nursing facility. Deciding when the appropriate time has come to move a loved one out of the home can be a very stressful and complex decision. Many caregivers and family members have a hard time adapting to and accepting this transition. And it's a decision that comes only after tremendous agonizing and soul-searching. When caregiving gets to the point of endangering the caregiver, when it's more than the caregiver can do, or when the caregiver can no longer provide the care the loved one needs, then it's time to make that decision.
Said I don't care. I promised her that I would never do that I would never put her in a nursing home.
When you're a caregiver, you feel like you will never, ever put your loved one in a nursing home. No matter what, you will never come to that point. You will always take care of them yourself. You're strong enough to take care of them yourself. When the time comes, you will realize that the time is there. And I think if you have done your homework in advance in checking out the nursing facilities, you will be much more comfortable with the fact that you have made the right decision for the right place. There are a lot of different types of nursing facilities out there. Some provide better care than others.
I don't envy anybody that has to go through that, of taking someone and having to put them in a nursing home. It's an awful thing to have to go through. I can tell you that. We miss her still. I try to go up at least 3 times a week and see her. My mom, on the days I don't go, my mother usually goes, just to keep a close eye on what's going on.
Part of being a caregiver is that you develop a sense of yourself based on what you're doing each day to care for your loved one. And when it comes to a point that your loved one may need to go into a nursing home, suddenly you're faced with, gosh, I get up in the morning and I'm not the caregiver anymore. I think it's difficult, but one of the things that we urge people to do is to realize that when their loved one enters a nursing home, it's not the end of being a caregiver. In fact, it may be that your role becomes even more important, because I hear this so often, that the people that receive the best care in a nursing home are the ones whose families are most involved. And so the more active a caregiver is in that day-to-day care in the nursing home, probably the better quality of care they'll see for their loved one.
When a person has to leave and go to a nursing home, it's a big shock. And even though the doctor and everybody else has prepared him for it, it's somehow a little sneaking suspicion that you want to get rid of him, that you're tired of giving the care. And it's hard to convince him of that. In our case, we couldn't. The thing we had to do was just to go over and continue doing the feeding and the shaving, feeding 1 meal a day and the shaving, and the cutting of the hair. And once, when I had a very bad cold, and I was afraid of transferring it to him, I called him. We had put a phone in his room. I called him and told him that I would be away for about a week, not coming over, because I had this cold. And he said, "You're not just throwing me away, are you, Grip?" And, you know, I sort of hurt, you know, to think that I would do that. But I really didn't convince him. He really wasn't sure until I started coming back.
Whether you're providing care for a loved one in your home or actively involved in their care in a professional health care facility, keep in mind that many of the stress factors are similar. The important thing to remember is there is no one right way. Each caregiving situation is different. The good news is that you can decrease some of the stress of caregiving by following 4 basic strategies. The first strategy might be called the cardinal rule for caregivers. That is, you must take care of yourself first. Risking your own well-being can seriously jeopardize the welfare of the patient and those closest to you. Your health is your most important ally as a caregiver. In order to have something to give, you must first give to yourself.
Before you can take care of someone else, you have got to take care of yourself. You have got to get up and, as much as you can, at least have that shower, get dressed, and a few minutes to yourself before you can take on the care of someone else.
Profound levels of self-care are needed in order to continue caregiving, and hard decisions like putting yourself first becomes necessary in order for you to do anything at all. And I think it's really hard for persons to make that switch and to realize that, in fact, what has all along been seen as the non-loving thing to do is now the most loving thing to do. Because if you can't maintain your own strength, then you can't be there for that person.
When you're in the position of giving someone that kind of total care physically and emotionally, you forget about yourself and it becomes 100% giving to them. Mm-hmm. But you have to keep yourself in order to give to them. So don't feel guilty about continuing to work or whatever it is that you do that keeps you together, whether it's reading, writing, creating, working, whatever it is. Continue to find some time to do that so that you can give them 100%.
In order to take care of yourself and protect your health, there are some basic guidelines to follow. First, eat properly, exercise on a regular basis, and get enough rest and sleep. Stay current with healthcare checkups, and practice preventive measures such as consulting with a nutritionist, learning yoga or relaxation techniques, or getting massages. Stay attuned to the physical and emotional warning signs for both compassion fatigue and depression. Preserve interests in relationships outside of caregiving, such as learning a new hobby or seeking career or vocational training. And equally essential is developing and maintaining a community support system, people you can count on when you need additional guidance or assistance. In addition to professional support groups, this community network can be made up of several healthcare workers and peers. Let's look at the various resources available to help you build this network. To begin, assemble a team of friends, family, co-workers, neighbors, even members of your religious organization, people you're comfortable calling on when a need arises. By assembling a primary support team of 6 to 12 people, it helps disperse responsibilities so no one person feels overloaded.
Involving others who can help you. This is when you find out who your true friends are, by who you can call on, who you can ask, for support. And I found out that there are people who are available who want to be of service but just don't know how to channel their desire to be of service. And just helping that caregiver understand that it's okay. It's okay to need a break.
Be ready to ask for help from family and friends, neighbors. It's very important because you're going to need that help.
Admit your weaknesses. If someone will say, I will come over and sit, use that time to take a nap, to run to the mall, if that's whatever you do to relieve stress. Don't be ashamed to acknowledge that you are stressed out, that you are tired. You've got to take care of yourself first.
I think the most important thing to remember is that people do want to help, and they're not just giving to you by helping you, they're also giving to themselves because it means something to them to be there for that person, just as much as it means something to you to be there for that person.
Job jars are a great idea some caregivers have used for help. They simply write down things they'd like to have done, such as going to the drugstore or fixing things around the house, maybe a sitter for a few hours while they go shopping or get their hair done. These little slips of paper are then folded and dropped into the jar. When someone comes over and asks what they can do to help, You say, pick one of the jobs out of the jar and help me with it if you can. Sometimes it's very difficult for caregivers to verbalize the help they really need, so it can be constructive to write these things down.
Don't feel like you can do it all by yourself, because you cannot. You need support. Go to your church, talk with your pastor, talk with your friends, let your family support you, talk with doctors. Find out what is out there for you, because there are things available there to help you. There are resources available for you, and use your resources.
In addition to your support circle of family and friends, talk to the various community organizations in your area and ask about the support services they offer.
It's important for caregivers to protect themselves from feeling overwhelmed by reaching out for help. And that can be as simple as making a phone call to an agency and asking for information. It can be as simple as finding out when a support group meets and going to the meeting. But the one thing that a caregiver can do to increase their risk of feeling overwhelmed and possibly developing depression is to remain isolated and not connect with other people who can support them.
I think one mistake I made was trying to do everything myself. I wanted to be there for him. My sister was in college. I didn't want her to have to drop out. My brother was out of state trying to keep his own life going. I didn't want him to have to stop what he was doing. So I really shut out opportunities for help from his friends, from my family, from his family. And I really regret that now. I think that it would have been important for them to be more involved. I mean, I'm sure they wanted the same things I wanted, to be able to have said, you know, I did this, I got to be there with him. Mm-hmm. And I fought having outside help, like the home health nurse and so forth. And I really wish I hadn't done that, because I think that emotionally I completely drained myself, and after a while I didn't have anything for him anymore. Mm-hmm. I didn't even want to go back and deal with it. I didn't want to go back into his room anymore.
Here's another valuable resource worth exploring. Ask your physician about the possibility of arranging for professional home health care workers to provide supplemental care. If your patient has specific emotional or physical medical needs, home health care organizations can usually provide the appropriate support you need, whether it's skilled nursing care, personal care aides, therapists, nutritionists, counselors, or social workers. However, for this to be covered by private insurance or Medicare, it typically must be prescribed by the attending physician. The duration and extent of this care is dependent upon the condition and prognosis of the patient and the policies of your insurance provider.
With home health care, they are there for you whenever you need them. It seems like with anybody, even with a child, they get sick on the weekends, and that's when you need help. That's when you need a doctor, you need a nurse. If you have home health care, they're there 24 hours a day, and you can call them 24 hours a day, and we did have to call them 24 hours a day, sometimes 2 or 3 times in the evening, and they will come on weekends, and they will assess the situation, take the vital situations, and they will call the doctor and talk to the doctor about whatever is going on and make a recommendation. So with home health care, that is a relief to the caregiver, because that is something that they don't have to take responsibility for.
If your loved one has a life-limiting illness, ask the physician about enlisting the assistance of hospice care. Hospice agencies have professionals on staff who are uniquely trained in providing the medical care and emotional support that the patient and family members need during the final stages of an illness.
There are caregivers, for instance, who really are able, just the act of caregiving is a source of incredible self-esteem, and the more they have to do, the better they feel. I mean, at some level, the better they feel about themselves. And those people, they do fine through this, and their real struggle is going to be at death. Mm-hmm. When they know, we talked at the beginning about how it is that you let go of caregiving, when you've been doing this for so long.
The emotional stress and strain of dealing with a loved one's limited life expectancy can create additional pressures, issues, and concerns. As the approaching loss of a loved one draws closer, your emotions and those of other family members may become more erratic and unpredictable in nature. From sudden crying to sudden laughing, from a sense of inner peace to a sense of inner turmoil. Try not to judge your actions or your thoughts too critically. It's especially important during this time for you, your family members, and your loved one to openly express emotions, wishes, and desires, and rely even more strongly on the support network you've established.
The other place that I have experience with chronic illness is in the end stages, when families are faced with whether or not to withhold or withdraw treatment, or when to choose treatment, when to institutionalize, what, in fact, should physicians offer to families? What is a reasonable thing to do? Do you offer the same treatment for someone who is essentially a healthy body lying in a bed with no mind, as opposed to someone who has a less healthy body but is fully cognizant and an important part of the ongoing life and relationship of the family? Those are hard ethical questions, and those ethical questions always bring us to the level of what our values are, what we believe. To see someone suffering, to see them have absolutely no life or a life of pain, of loneliness, of emptiness, of nothing, it's a loving thing to wish for them death. And so I think that's an important thing to understand, that's an act of love to have those feelings.
We talked about death and about dying and about what he thought maybe would happen afterwards and what I thought would happen. And I told him to come back and let me know what was going on. He hasn't.
Now that we've talked about the importance of taking care of yourself, let's look at the second strategy for caregivers, managing your expectations. Unrealistic expectations can generate unnecessary emotional stress. These expectations usually begin with the word should. I should be able to do more. I should feel differently. I should be able to handle this all by myself. By talking with others who have been in your situation, you can begin to set realistic expectations for yourself.
What I seek to help persons to understand is that what is important is their obligation. That in a family there is a sense of obligation. And when we can define obligation as being something separate from expectations, expectations are what other people many times create.
Or what we think.
Or what we think. My rule of thumb is that expectations always exceed any one person's ability to respond. There's always going to be more expectation than there is energy in the battery, so to speak. So part of the task is to look at the situation, look at oneself in that situation, and develop what I call a baseline of obligation. I have a line to go to. I can be below at some points. I'm not doing enough. I'm doing less than I have said that I'm obligated to do, but I know where to come back to, that baseline. Sometimes I'm doing actually more. I'm responding more to the need than I have said is my obligation, but then I don't have to stay at that level. I can then come back to the previous baseline level. In a sense, what that provides then is more flexibility of behaviors in a situation than not having that baseline, because many times if we're just working with expectations, either our own, well, I should do this, the shoulds and the oughts, then we can move into an untenable level, and then when we're unable to keep up that level of activity, that level of caring, and we drop back, then it's felt as failure. I'm no longer doing it, but I'm at an artificial high level, you see. So having that obligation level enables one to peak, come back, go down, come back.
Managing your expectations includes examining your attitudes and beliefs and how those influence the way you act and feel. For example, you cannot control other people or events. If you believe otherwise, you may find yourself in a chronic state of frustration, exhaustion, or apprehension.
Manage your expectations as a caregiver. Balance that with reality and what you can do, also what your patient can do.
Sometimes it's easy for caregivers to blur the lines between expectations and obligations. Often those feelings of obligation turn into sacrifices that aren't beneficial and may even be harmful.
I think that the key for me becomes this: sacrifices are important in everything we do if they benefit others. But if we sacrifice for the sake of sacrifice, nobody benefits from that. We're obligated to make sacrifices for the benefit of others, but we're not obligated to make sacrifice just so we can say we sacrificed.
Keeping your expectations realistic is a key component to effective caregiving. So the next time you feel out of control, inadequate, or find yourself rehashing everything that went wrong during the day, remember you have the power to decide how you respond. Let go of any beliefs that don't lead to positive actions. For instance, instead of belittling yourself, congratulate yourself for all the things you've done and accomplished. If you feel dejected, ashamed, or fearful, congratulate yourself for all the courage you have shown. Be gentle with yourself and forgiving. Tell yourself the comforting things you would say to a friend in your situation. Throughout the process, try to cultivate and maintain your sense of humor. Laughter is often the best medicine for stress.
Keeping a good sense of humor, just not getting too intense, too serious. It's real important that you laugh at yourself with what you're doing right, with what you're doing wrong. And, and sometimes when you're away from the from the patient, just to sit and laugh about, little funny things that have happened during the day. Laughter is a real good way to relieve some of the stress, that you're feeling.
The third strategy for caregivers is to identify areas where you'd like to make some changes. Change may involve a readjustment in your expectations, a change in your schedule, or a new way of doing things. For example, you may want to adjust your expectations for more manageable daily tasks so you don't overextend yourself. You may want to change the way you relate to the person receiving your care. Perhaps you've become too absorbed with the person's illness, or perhaps you're overdoing for your loved one instead of encouraging their independence. This can play an important role in your loved one's self-esteem and sense of independence.
I've had patients who are being cared for who will sometimes just cry and struggle with the fact that they are so dependent. Sometimes they're able to do a lot for themselves, and families need to encourage them to do whatever part of their hygiene or their care that they're able, to do. Don't run in and take it all over. Let the patient do as much for themselves as they are able to. It may not be done quickly. I've had families or caregivers say, by the time he does it, I could have done 5. But give him that time. Give that patient that time and that opportunity to do what they're able to do for themselves.
You have to let them do some little something where they feel like they're contributing a little bit to the family.
I think it's too easy to try to do everything for them, to take over and do everything, but they need that independence. They need to do as much for themselves as they possibly can.
I think most of it's centered around, most of the caregiving that persons ought to keep in mind, centered around whatever matters a whole lot to the individual to whom the care is given. And if it is not endangering his health, that he ought to be permitted to do it, even though the observer would think that it was stupid for him to do that it was childish or selfish or whatever. And you would think of it that he would have only some X number of years to live, and he might as well live those happily.
In addition to promoting independence, you may want to explore ways to keep the person involved in family life as much as their condition allows. From watching TV together to folding laundry to helping prepare meals, whatever task provides a sense of accomplishment is important to encourage. If your loved one has a life-limiting illness, you may find comfort reminiscing together about past events, discussing and resolving old hurts and disappointments, or talking about how to help put their affairs in order. Strategy 4, ask for help. Asking for help is the best gift you can give yourself and the person receiving your care. Start by identifying what type of assistance would feel truly helpful to you. Sometimes people's attempts to help actually create more stress, so it's important for you to decide what kind of help you need. You may find you need information, professional advice, or support for your own decision-making. You may simply need someone to listen as you retell the day's events. A good listener can help you explore feelings and problems.
Finally, it dawned on me that I could attach with my computer to the internet, to a mailing list, and talk to people at night without getting on the telephone and bothering any of my friends or relatives. So I did attach to the World Wide Web, to a mailing list, actually more than one, and found that anytime, day or night, I could get up and go to my computer and I could start reading mail from other people that are going through similar situations, and I could type and tell my feelings to them. This was much needed support that has actually helped me for at least a year and a half now, and is continuing to help me.
Now let's explore the various areas where asking for assistance could be valuable. We've previously discussed ways for you to seek support for your emotional needs through support groups, family, friends, and others within your community network. Next, let's look at some other areas where outside assistance may be valuable, starting with the physical aspects of caregiving. In addition to requesting home health care, you may want to periodically hire a personal care assistant to help with the patient's daily living activities, such as bathing, dressing, and eating. These healthcare professionals can also teach you caregiving techniques and help you organize a functional routine. Another option is utilizing a professional sitter to not only give you some extra time off, but also provide a new source of companionship for the patient. Adult daycare and respite care are other alternatives that can be beneficial to you and the person receiving care. Another area where assistance can be worthwhile is household activities. The day in and day out chores associated with keeping the house clean and organized can become daunting. You may want to hire neighborhood teenagers to run errands, or a housekeeping service to do some of the cooking or cleaning. Also, consider asking family members or friends to share in certain tasks, such as laundry, yard care, or preparing a meal.
That is the hardest thing, is having a job 24 hours a day that doesn't seem to ever quit. So you have to have some kind of relief. You can do that like my sister and I have by switching off, or you can do that by having temporary help to come in.
Your job and work environment might be another factor producing stress. You may want to ask your employer to adjust your workload or give you some extra time off, maybe even grant a leave of absence. Depending on your employer, the Family Leave Act may provide you with some relief. Many times in the caregiving process, conflicts and relationship issues develop between the patient and caregiver or other members of the family. It's not uncommon that caregiving causes or aggravates marital or family problems. When this occurs, it frequently helps to have the intervention of an objective professional who can advise you about how to handle the situation.
In a total family, whether it be an immediate family or an extended family, there could very easily be a set of obligations, you see, that each one is like a piece of a puzzle. Each person's set of obligations, so to speak, fit together in a pattern with all the others, so that you have this mosaic of total care that then I think is much more functional than without that sort of give and take, that communication, which is so important. I mean, families need to talk with one another in these situations. Talk is the most important factor that I can see.
Other areas of conflict which commonly occur involve patients who are attempting to cope with or adjust to a serious illness. They may be in discomfort or suffering from dementia. These individuals may exhibit troublesome behavior by doing or saying things you find embarrassing or hurtful.
Respect of the person, even though they're older, even though they're incontinent, even though they have memory loss, even though they don't look like they used to look. You have to remind yourself sometimes about the respect that is due the individual, and then show them that respect.
Well, you have to give them a lot of love. Let them know that you love. Touch, you know. This is the main things. Don't scream to them because they don't know. They don't understand. Try don't lose the passion. If you are angry, be angry yourself in a room, or go outside and scream or whatever, but, you know, this is what I advise. Be patient.
The hardest thing about being a caregiver, first of all, is not being able to get away. And when they get mad at you and argue with you or hit at you or something like that, to keep your temper. Because you're human.
Caregiving can also arouse spiritual questions and conflicts. One of the most common reactions to an illness or life-limiting diagnosis is, "Why me?" or "Why my loved one?" Quite often, spiritual advisors can help you find strength and resolution in this process.
The question that is raised sometimes with persons when they're the care giver in a situation in which they're experiencing loss, this loss. There is sometimes a feeling of, why me? Why me, Lord? Why did this happen to me? I've been an exemplary person, you know, I didn't do anything to deserve this. It's sort of the opposite. And why him, you know, or why her? Why did this happen to this person when somebody else was a whole lot worse, you know, behaviorally, and why didn't it happen to them? My response to that is, those are normal feelings. And that's my stock answer. It has to be. Those are normal kind of feelings that all of us, any normal person, given the situation, is going to experience. Health is not about not experiencing these feelings. Health is about experiencing them, looking at them, putting them into context, realizing where they come from and what they're about, and then now it's a part of my life, part of my experience. I've had that experience, I've had that feeling, and now I go on.
In the early stages of grief, my experience is that persons tend to rely really heavily on what could be called pat understandings of religion. You know, this is God's will. God never, you know, closes a door without opening a window. We appeal to sayings that we have heard that give us a kind of short-term strength. But as the illness progresses and time drags on and one loses one's emotional stamina, then one begins to appeal to God in different ways, and one begins to beg. I mean, one finds oneself in the position of begging for strength, begging for understanding, begging for a sense of self-control. From there, what you begin to see and experience is a kind of exhaustion from that process. I mean, we go through our lives and we get to respond to each other for who we are, and now we can't do that anymore. And so we have to become, in some ways, a professional. What a professional learns to do all of the time, we have to do with a family member. And there becomes, out of that exhaustion, a kind of despair and a kind of disorganization. so that it becomes hard to keep the rest of your life together. And that's when I think the most serious faith questions arise. You know, why is God doing this? Why does God allow this to happen? What kind of a good God would let this be a part of the picture of creation? And those are the questions for which there are not only not easy answers, but sometimes we find ourselves like Job in the whirlwind. There isn't an answer, except that it is. And somehow we find strength and love and support to make it through that. There is no place, at least not in the Judeo-Christian faith, which promises health and an absence of suffering in return for faithfulness. I mean, the faithful always suffer. And that's what has led us through the ages to ask the question then, is suffering necessary for spiritual growth? And the answer for me has to be no, but it is a possibility for spiritual growth.
There are times where you may have difficulty adjusting to the decline in your loved one's mental or physical condition. You may be mourning the loss of your normal relationship with your loved one. Or, in cases of terminal illness, you may be struggling with the inevitability of death. These are various forms of bereavement, and for many can be extremely complex issues to face. Seeking professional guidance or turning to an understanding ear can be particularly helpful during this time of emotional upheaval.
Every emotion you can imagine. I was angry, I felt guilty, I was upset, I was depressed, I was happy to be able to be there for him, I was angry that my life was on hold. I mean, every emotion I think you can go through, I went through. I was angry because here he is, my father, the supposed caretaker, and now I was having to take care of him. Everything, his financial decisions, his home decisions, as well as just his physical being. And I had thought that at the time that I was independent, I'd been living on my own, making my own decisions, but I really realized how dependent I still was on him. I don't know that your father ever doesn't become your father, you know.
Sometimes we find with caregivers of Alzheimer's patients that they will experience grief prior to the loss of their loved one, that just by seeing the disease transform their mother or father or their spouse from the person they once knew into someone who has a very different personality or who no longer knows who they are. That can really cause someone to grieve because they are losing someone who's dear to them while that person is still alive.
Once your caregiving responsibilities have ended, you may be surprised to discover new emotional challenges ahead of you. Many caregivers experience a sense of lost purpose or have difficulty adjusting to the extra time suddenly on their hands.
We imagine in our mind that death would be a source of relief, and it never is. It's just a new kind of grief. It may relieve us from some of the caretaking, but not the suffering, the emotional suffering that we're going through.
One of the things that I try to do with caregivers when they have lost a loved one is to talk about the grief process and what is normal for someone who is grieving. And it's not going to be the same for every individual, but it's important to realize that there are a lot of emotions that can come out once you lose someone that you love, that it's a normal part of that process to be angry sometimes, to be shocked that it's happened, to deny that it's happened, or just not want to face up to the fact that your loved one is now gone. That some people get depressed as a part of the grief process. And all of these things are part of grieving, and it takes time. And it may take longer for someone than it does for someone else, but it's important to give yourself that time and to seek support if you feel like you need it.
I am so thankful I have siblings. They were everything to me. The best thing we went through dealing with his death, and even when he was still sick, was the three of us getting together and talking about him. Talking about stories we remembered, getting a perspective for what a different man he was to all three of us was fascinating.
There's only one antidote to grief, and that's comfort. It's being comforted. And in order to be comforted, one has to be in relationships.
I hope this in-depth look at the emotional complexities of caring has been insightful and helpful. For many people, coping with the caregiving process can be compared to flowers in a garden. It's an experience of unpredictable growth and self-realization dependent upon many factors. Some days when conditions are sunny and bright, the results may appear vibrant and full of color, while other days may seem dreary and lacking. But always remember, you're not alone in your feelings and your reactions, and there are people who are willing and ready to support you in this very loving deed that can have a profound impact on the rest of your life.
It completely changed my perspective as to what's important in life, and that's something that is hard for me to hold on to, but I try to remember what it was like then.
A caregiver has an excellent opportunity to prolong a person's life by making him as happy and as comfortable as he can be.
It's not easy, and it's not going to be easy caring for a loved one, no matter how much you love that person. No matter, it's going to be difficult, and there's just no there's no magic cure for that.
Probably my biggest advice to caregivers is just that to hang in there, because there will be times when you feel like you cannot go on. But you will go on, you will make it. But please ask for help when necessary, because if you don't, you're going to end up being the one that is in the hospital bed, and you're not going to help your loved one in any way if you're in that hospital bed.
We all have to look inside of ourselves and know what works for us. How do we cope? Is it through laughing? Is it through writing things in a journal at the end of the day? Is it through taking a walk around the neighborhood or going to exercise? Is it through talking to a friend? Is it through prayer? Just to realize what works for you and then to do those things is very important.
A great deal of personal pleasure and enjoyment can come out of just how they look at you, what they say to you, and sometimes just a smile that shows how much they appreciate what is being done.